years. Patients frequently underestimate the significance of a balanced lifestyle, opting for convenience over health. This dismissive behavior can result in chronic health conditions. In today's world, the relationship between patients and doctors often becomes strained, with misconceptions leading to a variety of issues. Many patients find it difficult to adhere to prescribed medicines, dismissing their importance as mere suggestions. This attitude not only undermines the treatment plan, but also jeopardizes recovery, making it imperative to understand that physicians prescribe medications based on thorough assessments to promote healing and well-being. Moreover, dietary recommendations and exercise routines outlined by doctors often fall on deaf ears. Patients frequently underestimate the significance of a balanced lifestyle, opting for convenience over health. This dismissive behavior can result in chronic health conditions worsening, which could have been averted with small lifestyle adjustments. It's important for patients to realize that their doctors possess knowledge and experience acquired through years of education and practice. The tendency to skip regular follow-up checkups further complicates matters. These appointments provide doctors with an opportunity to reassess treatment efficacy and make necessary adjustments. By neglecting these visits, patients risk losing sight of their health trajectory. They might believe that as long as they feel fine, further consultation is unnecessary, when in fact, early detection of potential issues can lead to positive outcomes. Some patients harbor a misguided belief that they understand their health better than their doctors. This can lead to dangerous self-diagnoses or neglecting serious conditions that only trained professionals can identify. Health literacy is crucial, yet it must be balanced with trusting the expertise of medical professionals who can provide well-founded insights and recommendations. Additionally, the association of healthcare with financial burden often results in a reluctance to seek necessary medical help. Many individuals consider health checkups to be an extravagant expense, choosing instead to wait until a health crisis erupts. This reactive approach compromises the opportunity for preventative care that could save both money and lives. Considering these factors, one can argue that doctors are often right in their assessments and recommendations. Their expertise is essential to guiding patients towards better health choices and ensuring they stay on the right path toward recovery. Emphasizing collaboration between patient and physician can create a proactive approach to health, enabling better outcomes for all.
I'm sure you've heard the talk about Ayurveda and diabetes. Some say it's a miracle. But what's the real story? Ayurveda is an ancient system that focuses on balancing your body's energies using diet, lifestyle, and herbs. Some popular herbs, like bittergourd, fenugreek, and turmeric, may help manage blood sugar when used alongside your regular care. Practices like yoga and meditation can also support your overall well-being. But here's the key. Ayurveda is not a cure for diabetes. Never stop your prescribed medications, and always check with your doctor before trying Ayurvedic remedies, as some herbs can affect your blood sugar or interact with your medicine. Stay safe, stay informed, and remember, managing diabetes is a team effort. Like, share, and subscribe for more simple health tips.
Hello everyone. Today, we're going to talk about something incredible inside your body that you probably never think about. It's a powerful network that works tirelessly day and night to keep you healthy and clean from the inside out. I'm talking about your lymphatic system. Imagine your body as a bustling city. You have roads for blood to deliver oxygen and nutrients, kind of like a food delivery service. But what about the trash? Every city needs a sanitation department, a sewer system to carry away waste and keep things running smoothly. That is exactly what your lymphatic system does. It's your body's very own garbage collection and recycling crew, and it's one of the most important systems for your overall health and vitality. This amazing network is a silent hero. Unlike your heart, which pumps blood constantly, the lymphatic system doesn't have its own pump. It relies on you, your breathing, your movement, your daily activities to get its job done. It's a complex web of vessels and nodes that runs throughout your entire body, just under your skin. Its main job is to collect excess fluid, cellular waste, toxins, and other unwanted materials from your tissues and transport them away. This fluid, called lymph, is then filtered through lymph nodes, which are like tiny purification centers packed with immune cells that destroy harmful invaders like bacteria and viruses. When this system is working well, you feel fantastic. But what happens when this crucial system gets backed up? Think about what happens when a city's sewers get clogged. Things get messy, smelly, and dangerous very quickly. The same thing happens inside your body. When your lymphatic system becomes stagnant or blocked, all those toxins and waste products have nowhere to go. They get stuck in your tissues, creating a toxic internal environment. This can lead to a whole host of problems that you might be experiencing right now without even knowing the cause. It's a hidden source of so many common health complaints, from feeling tired all the time to nagging aches and pains. Most of us, and even many doctors, tend to overlook the lymphatic system. We focus on the heart, the brain, and the gut, but we forget about the master cleaning crew that supports them all. This is a huge mistake. A healthy lymphatic system is the foundation of a strong immune system, clear skin, a sharp mind, and an energetic body. It's the key to reducing inflammation, fighting off illness, and feeling your absolute best. Understanding how to support this system is not just a health tip. It's a revolutionary way to take control of your well-being. Today, I'm going to show you how you can give this forgotten system the attention it deserves. Your body is brilliant at sending you signals when something is wrong. The problem is, we are often too busy to listen, or we don't understand what it's trying to tell us. When your lymphatic system is struggling, it sends out a variety of warning signs that are easy to dismiss as just part of getting older or stress. One of the most common signs is persistent fatigue. Do you wake up feeling just as tired as when you went to bed? That feeling of being drained, no matter how much you rest, could be your body swimming in its own unprocessed waste. Another major clue is brain fog, that frustrating feeling of mental cloudiness, difficulty concentrating, or struggling to find the right words. Look in the mirror. Do you notice puffiness in your face, especially around your eyes in the morning? Are your rings suddenly feeling tight on your fingers, or do your ankles swell by the end of the day? This isn't just water retention. It's often a sign of stagnant lymph fluid. Your body is holding on to this toxic fluid because the drainage system is backed up. You might also experience mysterious aches and pains. That stiffness in your joints, tender spots on your body, or frequent headaches could be caused by the buildup of inflammatory waste products that your lymphatic system can't clear away effectively. These are not random symptoms. They are direct messages from your body begging for help. Other common red flags include skin problems like acne, rashes, or cellulite, which can worsen when toxins are trapped beneath the skin. Are you constantly battling sinus issues, allergies, or post-nasal drip? Your lymphatic system plays a huge role in the health of your head and neck, and congestion there is a classic sign of a problem. Even your digestion can be affected. If you suffer from bloating or constipation, it could be linked to poor lymphatic drainage in your abdomen. All these little issues might seem unrelated, but they can all point back to one single root cause, a sluggish, overwhelmed lymphatic system that needs a serious cleaning. The danger of ignoring these signs is that they can escalate into much more serious health problems. A blocked system means that your immune cells are trapped and can't get to where they need to be to fight off infections. This leaves you vulnerable to getting sick more often. Over time, this chronic toxic buildup can contribute to chronic inflammation, which is the root of almost every major disease, from autoimmune conditions to heart disease and even cancer. Your body is designed to heal itself, but it can't do that if it's drowning in its own garbage. Recognizing these early warning signs is the first, most powerful step toward preventing bigger issues down the road. So, what can we do about this? How do we get this vital system flowing again? I want to introduce you to a true pioneer in this field, Dr. Perry Nicholson. He is a chiropractor and functional medicine expert who calls himself the lymph maniac. Dr. Nicholson faced his own health crisis with an autoimmune disease, and through his journey to heal himself, he uncovered the profound importance of the lymphatic system. He realized that no treatment would be effective if the body's drainage pathways were clogged. He saw that this was the missing piece. in so many people's health puzzles, the reason they weren't getting better despite trying everything else. Dr. Nicholson dedicated his work to understanding this system and developed a brilliantly simple yet incredibly powerful sequence of movements to manually activate it. He calls it the Big Six, and it's a game changer. This isn't some complicated, time-consuming workout. It's a series of gentle rubs and taps on 6 key areas of your body where major lymph nodes are clustered. These areas act like major drains in your body's plumbing. By stimulating them in a specific order, you create a pull effect, systematically clearing the blockages from the top down and encouraging the lymph fluid to start moving toward its final drainage points near your heart. The magic of the Big Six is its simplicity and accessibility. Anyone can do it, regardless of their age or fitness level. You don't need any special equipment or a gym membership. All you need is your own 2 hands and about 5 to 10 minutes a day. You can do it standing in your kitchen while waiting for your coffee to brew, or sitting at your desk when you need a quick break. Dr. Nicholson designed this routine to empower you, to put the control of your health back into your own hands. He understood that the most powerful health solutions are the ones people will actually do consistently. Think of it like this. If you have a clogged sink, you don't just pour water in and hope for the best. You have to clear the main drain first. The Big Six works on the same principle. It starts by opening the largest lymphatic drains in your body, located near your collarbones. Once those are open, you work your way down, clearing the pathways in your neck, armpits, and abdomen. This logical sequence ensures that the stagnant fluid has a clear path to exit, preventing it from just getting stuck somewhere else. It's a smart, strategic approach to whole body detoxification, and it can help you feel better almost immediately. Are you ready to try it? Let's walk through the Big Six routine together. It's so easy, you can, follow along right now. Remember to be gentle, you're just stimulating the vessels right under the skin, so you really don't need a lot of pressure. The first step is to open the main drains. Place your fingertips on either side of your neck, just above your collarbones in that soft, hollow area. Gently stretch the skin down and toward the center, about 10 to 15 times. This is where your lymphatic system ultimately drains back into your circulatory system, so we always start here. This is the most important step. Next, we move up to the sides of your neck. Take your flat palms and place them on the sides of your neck, just below your ears. With a light sweeping motion, gently pull the skin downward toward your shoulders. Think of it as guiding the fluid down toward the drains you just opened at your collarbones. Repeat this gentle pulling motion about 10 to 15 times. You're clearing the path for all the lymph from your head and face. This one move can be fantastic for relieving sinus pressure, headaches, and that feeling of fogginess. It's like opening the windows in a stuffy room. Now let's move to the armpits, another major hub for lymph nodes. Take your right hand and place it in your left armpit. Gently pump or rub the area 10 to 15 times. Then switch sides and do the same for your right armpit with your left hand. This is especially important for women's health and for anyone who uses deodorant, as these products can sometimes contribute to congestion in this area. After the armpits, we move to the abdomen. Place both hands on your belly around your navel. Gently press in and make deep clockwise circles. This not only stimulates lymph flow, but also aids digestion. Finally, we clear the lower body. The last 2 points are the groin area and the back of the knees. For the groin, you can gently tap or rub the crease where your leg meets your torso. For the back of your knees, simply use your fingertips to gently pump or rub that soft area. By performing these 6 simple steps in order, you have systematically activated your entire lymphatic system from top to bottom. Dr. Nicholson also recommends some bonus moves like deep power breathing, shaking your whole body like a wet dog, or doing gentle self-rebounding, bouncing on your heels to keep the momentum going. Just a few minutes is all it takes. Can 5 or 10 minutes a day really make a difference? Absolutely. The power of the Big Six is in its consistency. By performing this simple ritual every day, you are constantly keeping your body's internal river flowing. You are preventing the buildup of toxins before they have a chance to cause problems. Think of it like brushing your teeth. You do it every day to prevent cavities and keep your mouth healthy. The Big Six is like internal brushing for your entire body. The small daily effort adds up to profound long-term health benefits that you will see and feel. You can reclaim your energy, sharpen your mind, and soothe your aches and pains. The beautiful thing about this practice is that the results can be felt very quickly. Many people report feeling lighter, more clear-headed, and more energetic after just a few sessions. That puffiness in your face can start to subside. That stiffness in your joints may begin to ease. Why? Because you're actively helping your body do what it's designed to do, clean and heal itself. You're removing the obstacles that were holding you back from feeling your best. This isn't a magic pill. It's you actively participating in your own wellness journey and becoming your own best healer. This is the ultimate form of self-care. I want to leave you with a message of hope and empowerment. You do not have to accept feeling tired, foggy, and achy as your new normal. It is not an inevitable part of aging. Your body has an incredible capacity for healing, and you hold the key to unlocking it. The Big Six is more than just a set of exercises. It's a declaration that you are taking back control of your health. It's a simple, free, and powerful tool that you can use anytime, anywhere to start feeling better right now. Don't underestimate the impact that these small, consistent actions can have on your quality of life. So, I encourage you, I challenge you to give it a try. Start today. Take 5 minutes this morning to go through the steps. Pay attention to how you feel afterwards. Make it a part of your daily routine, just like your morning cup of coffee or tea. You have nothing to lose and a whole new level of health and vitality to gain. You have the power to clean up your system, boost your immunity, and unleash the vibrant, energetic person you are meant to be. Your journey to a healthier, happier you can begin right now, with one simple, gentle touch.
Hello, I'm
Fasting is
Ramesh
not just a
Aralikatte.
trend,
I
it is a
have over 30
fascinating
plus years of
phenomenon that deeply
experience navigating
influences
the
our
healthcare
body's
system,
metabolism,
not as a doctor, but
particularly
as
in
a
the
patient.
context of blood glucose levels. When the body enters a fasting state, a complex dance begins, a symphony of hormones and chemical reactions aimed at maintaining homeostasis. The initial hours after a meal are marked by elevated blood sugar levels as the body digests and absorbs nutrients. However, as fasting continues, the story of blood glucose shifts dramatically, reflecting the body's remarkable adaptability to periods without food. The interplay of counterregulatory hormones is pivotal in understanding how fasting affects blood glucose. Hormones such as glucagon and epinephrine take center stage, acting to increase the availability of glucose in the bloodstream. As you fast, these hormones trigger the liver to release stored glycogen, ensuring that the brain and muscles continue to receive the energy they need. This response not only maintains normal blood sugar levels but also showcases the body's ability to switch gears, leveraging stored energy to fuel ongoing functions. Through the lens of the dawn phenomenon, we see another layer of complexity in the relationship between fasting and blood glucose. Each morning, as dawn breaks, the body begins producing glucose in preparation for the day ahead, regardless of fasting status. This occurs as a natural response mediated by hormones, causing blood sugar levels to spike even without food intake. Understanding this phenomenon highlights the adaptive strategies the body employs during fasting and illuminates why individuals might wake with higher blood glucose levels, even after hours without eating. A question often raised is whether fasting causes low blood sugar levels. While it may seem logical to assume that refraining from food could lead to hypoglycemia, the reality is much more nuanced. For individuals without underlying health issues, intermittent fasting can promote stable blood sugar levels instead of causing them to dip dangerously low. Scientific studies reveal that, for many, fasting can improve glucose tolerance and insulin sensitivity, challenging misconceptions surrounding fasting and its effects on blood sugar management. Lastly, during fasting, the body begins to produce ketones, a fascinating alternative energy source. Ketones provide a more efficient energy source than glucose, especially for the brain. This metabolic shift not only helps in supporting cognitive functions but also underscores the remarkable resilience of our bodies when adapting to fasting. By understanding the intricate relationship between fasting and blood glucose, we begin to appreciate the profound impact of this practice on overall metabolic health, transforming our approach to nutrition and energy management.
Understanding the connection between our skin and heart health can be life-saving. A study highlights 12 crucial signs that your skin and nails might reveal heart troubles long before more serious symptoms arise. It's essential to be aware that conditions like heart disease can manifest through seemingly unrelated dermatological changes, making early detection vital. Swelling in the feet or lower legs, commonly known as edema, is one of the first signs to watch for. This swelling occurs when the heart struggles to pump blood effectively, causing fluid to accumulate. Similarly, cyanosis, which is characterized by blue or purple skin, points to underlying oxygen problems. These color changes can suggest blocked vessels or lack of oxygen reaching the tissue, highlighting the importance of recognizing such symptoms quickly. Another skin change, livedoreticularis, presents as a net-like purple pattern. This can indicate potential issues with small artery blockages, a sign that should not be overlooked. On the other hand, yellow or orange waxy growths known as xanthelasma might signal cholesterol deposits, while sudden clusters of bumps, referred to as eruptive xanthomas, are often linked to high triglycerides or diabetes. Both warrant immediate medical consultation. Nail changes can also unveil cardiac concerns. Clubbing of the nails, where fingertips swell and nails turn downwards, often correlates with lung or heart conditions. Red or purple lines beneath the nails, known as splinter hemorrhages, may indicate infective endocarditis, a serious bacterial infection of the heart. The presence of smooth, waxy lumps called amyloid nodules can suggest protein accumulation and potential heart-related implications. Moreover, painful lumps on the fingers, termed Osler nodes, signal the possibility of bacterial heart infection, while painless brown or red spots on palms or soles, called Janeway lesions, can also indicate infective endocarditis. Non-itchy rashes accompanied by fever, as seen in erythema marginatum, are often associated with rheumatic fever, particularly in children. Moreover, Kawasaki disease can reveal itself through a rash and cracked, bleeding lips, particularly in the young. These skin and nail signs serve as vital signals that something may be amiss with the heart. Regular monitoring of your skin and nails can be crucial. If you spot multiple signs or experience other symptoms like fatigue, shortness of breath, or an irregular heartbeat, seeking medical advice promptly is essential. Conducting regular health checkups, especially after the age of 40, can significantly enhance early detection and prevention of severe complications. Stay alert to what your body is saying. Your skin might just be hinting at heart health issues.
Advice. The content available in our YouTube videos or on our social media page like Instagram, Facebook, and X do not provide a diagnosis or other recommendation for treatment and are not a substitute for the professional judgment of a healthcare professional in diagnosis and treatment of any person or animal. We intend to provide educational information only.
You have diabetes, regular checkups aren't just a good idea.
ये 10 बातें आपकी जिंदगी बदल देगी। नंबर 1, हेयर ड्रायर से निकलने वाली हीट आपके बालों के जादू को नुकसान पहुंचाती है। हेयर ड्रायर करने से पहले अपने बालों में तेल या सीरम लगा ले। ज्यादा गीली बालों में लगाने से बचे। नंबर 2, हेल्दी स्किन, हेल्दी हेयर और बेहतर ब्लड सर्कुलेशन के लिए जामुन का सेवन करना चाहिए। ये काफी फायदेमंद होता है। ऐसी और जानकारी के लिए फॉलो करें।
If you have diabetes, regular checkups aren't just a good idea. They're a must. Managing diabetes is a lifelong journey, and your doctor is your partner every step of the way. These visits are about more than just checking a box. They're your chance to catch problems early, adjust your treatment, and get the support you need to stay healthy. Wondering how often you should visit your doctor? The answer depends on your type of diabetes, your overall health, and how well your blood sugar is controlled. Let's break it down so you know exactly what to expect. Diabetes is a lifelong condition that needs regular check-ins with your doctor. These appointments are your opportunity to ask questions, share concerns, and make sure your treatment plan is working for you. Your doctor can help you set realistic goals and celebrate your progress along the way. Why? Because your doctor keeps track of your blood sugar, checks your A1C, and looks for any early signs of problems with your eyes, kidneys, or nerves. They'll also check your blood pressure, cholesterol, and weight, since these can all affect your risk for complications. Sometimes, you might need extra tests to make sure your heart and other organs are healthy. Spotting these issues early can make a huge difference in your health. Early treatment can prevent serious complications and help you feel your best every day. Remember, your doctor is there to help you live well with diabetes, not just to treat problems after they start. So, how often should you go? The answer isn't the same for everyone, but there are some general guidelines to help you plan. If you have type 1 diabetes, you'll likely need to visit every 3 to 6 months. These regular visits help you and your doctor keep a close eye on your blood sugar, adjust your insulin, and talk about any challenges you're facing. If you're starting a new medication or having trouble with your numbers, you might need to go even more often. For type 2 diabetes, if things are stable and your blood sugar is well controlled, every 6 months might be enough. But if your blood sugar is tough to control, or if you're making changes to your medication or lifestyle, every 3 months is better. These visits are a great time to review your progress and make sure your plan is still working. Gestational diabetes? You'll need to check in monthly or even more often to keep you and your baby safe. Your doctor will want to monitor your blood sugar closely and make sure your pregnancy is progressing well. Sometimes you may need to adjust your treatment quickly, so don't skip these important visits. No matter what type of diabetes you have, there are some checkups everyone needs. And don't forget, everyone should get their eyes, feet, and kidneys checked every year. These screenings can catch problems before you notice any symptoms, and they're a key part of staying healthy long-term. Sometimes telehealth or at-home monitoring can help you cut down on in-person visits. Virtual appointments are a great way to stay connected with your healthcare team, especially if you live far from your doctor or have a busy schedule. Home glucose monitors and apps can help you track your numbers and share them with your doctor between visits. But remember, see your doctor sooner if you're feeling extra tired, have blurry vision, numbness, or start new medications. New symptoms or changes in how you feel can be a sign that something needs attention right away. Don't wait for your next scheduled visit if you're worried about your health. Staying on top of your health means more than just going to appointments. Eat healthy, stay active, check your blood sugar at home, and set goals for yourself. Small changes can add up to big results over time. Talk to your doctor and make a plan that's right for you. Every person's diabetes journey is unique, and your care should fit your needs and lifestyle. Don't be afraid to ask questions or speak up about your concerns. Want to learn more? Visit diabetes.org for more tips, resources, and support to help you manage your diabetes and live your healthiest life.
Managing blood pressure is crucial for overall health, and there are effective
Hello,
natural
I'm Ramesh
strategies to help
Aralikate.
bring those
I have
numbers
over
down.
30 plus
One of the
years of
fundamental
experience
steps is to cut
navigating the
sodium
healthcare
and
system,
processed foods
not as a
from your
doctor,
diet.
but as a
Aim
patient.
for less than 1/500